thank you guys for being here today. And I'm so excited to be in a conference like this when there's so much data and so much information. So I'm Sigi. I'm a nurse practitioner actually in my profession and have been a telehealth consultant since 2009. My company, Telehealth Consulting Services, started a telehealth program for 65 of very large health organizations, to name a few: Kaiser Southern California, DaVita, and others, and VSee and others. Who here is a parent? Okay, well, you guys all know what I'm about to talk about. How many people here build a crib? Good. Do you have good instructions to how to build that crib? Did you feel like you're well instructed on that? Right. What about that baby when you came out of the hospital? Did you have good instruction about how to build that baby? Probably not. I recently went to Africa where I started a telehealth program, and I had a chance to meet with the Department of Health administrators there. And one of the things, a quote that I'm going to tell you about, that he said that was really renowned for me is, "A society that does not take care of its moms and babies does not take care of its future." So, this is BabyLive Advice. One of the most sounding facts that maybe people don't know about is that the United States is actually the last one in maternal child death from the industrial world. We have more women dying here, giving birth to babies, than any mother in Mexico or Kyrgyzstan. In fact, the fact is that fact that women are dying of childbirth here in the United States has increased in 27% since 2014. So it's not that we're just not doing good. We actually are not doing better. I want to give you some statistics that will probably astonish most people who don't know anything about this. I'm read them because I want to be accurate. These are all recent statistics that were put out by the CDC. So no developed nation has the rate of maternal death and injury as we do here in the United States. American women are 3 times more likely to die from childbirth before or after than any woman in Canada. African American women have 40% higher chance of dying through child-related services than any woman in the United States. For every woman who dies from giving birth to children, 70 women get severe injury or illness. According to WHO, black women in the United States die in a rate of 1 to 5 from pregnancy-related injuries. So these are really horrible statistics. I have learned about them while I was doing some work at Kaiser in 2014. Indirectly, I'm actually a family nurse practitioner and did not know about those facts, myself, as most of the work that I do is actually in emergency medicine. I have seen those women come into the emergency room bleeding after childbirth, having horrible infection after seeing C-sections, seeing babies who unfortunately were dying in the crib or have severe injuries. But I never put one and one together into what does it all mean for us. So, premature birth and fetal demise. Another horrible statistics here in our excellent healthcare system. 15 million babies are born prematurely every year across the world. 500,000 babies are born prematurely here in the United States. 70% of premature birth are born between the age of 34 to 36 weeks of gestation. The number of premature births increased 28% in the last 3 years. Fetal demise, babies dying close to their birth or in the mom's womb, 22,000 cases per year. All of them are preventable. So another reason we see in a lot of premature birth is the increase in C-section or elective C-section And of course, that also increases the rate of maternal morbidity and mortality here in the United States. And there is a massive cost that is associated with this. So we have 4 million babies born in the United States yearly, and $26 billion is the cost of the premature birth in the United States. $400 billion is maternal morbidity and mortality costs in the United States. Put it all together, we're spending a lot of money on something that is 60% preventable. By the way, I'll give you another fact that is quite shocking. Last year, it is 2018, there was a total of $600 billion of awards. That is malpractice and other settlement awards around maternal child death in the United States. And those awards are planned to be growing for next year because there's a few rules that are being passed by insurance companies about this. So the March of Dimes have identified what they call the maternal desert. Why is this happening? And why is this happening in a country that has such a wonderful healthcare system? Well, every red dot on this chart is a place when there is no OBGYN or a hospital who can deliver a baby. We have maternal deserts all over the United States where the woman actually living here in the United States is less likely to see a doctor related to her pregnancy than any woman in Africa, Kenya, where I visited in January. What happens? Where are all those doctors at? Well, they're not just all in urban areas. We actually are losing a lot of physicians into that space. There's a lot of physicians who are not going into the maternal child health due to the insurance and the malpractice insurance, the amount of time that it gets to be trained, and 46% of maternal child health physicians will tell you that they are burned out. They've seen 30 to 40 women a day. A lot of them are responsible for those women's health and for this baby's health up to 18 years of age. There is a lot of risk in this population, and also, they feel like they are just doing a horrible job in caring for large populations. So what did I do? I'm a mom, I'm a telehealth consultant, and I have a lot of good friends in the business. And I figured, what can I do to kind of help this horrible statistics and make things better? Well, I needed technology, which I have. Do I know some people in this room? I'm not going to say who. And providers. What kind of providers can actually change the pentagram on this? And so I decided, because I'm a nurse practitioner and I like to work with nurses, and because nurses can work across state lines, that I will hire mostly nurses, nurse practitioner, midwives, lactation consultants, nutritionists, mental health providers, and others, to educate women all throughout the prenatal period and postnatal period to prevent some of those complications that we've seen by providing them with excellent health promotion, monitoring of the chronic condition, and escalation to physicians that are in our network, and we are collaborating with networks to provide the best care, holistic care, to those moms and babies. Using an application that is being given to the mom by her physician, by the way, we are taking on moms in the prenatal time to do some prenatal education in between physician appointments. This is really about nutrition. It's about your mental health. It's about your blood pressure. How are you planning to go back to work? What kind of lactation programs you're gonna have? And of course, all the stuff that she needs to know about her newborn, and do some prenatal education around newborn care as well. We start with moms on the first day of the pregnancy, and we stay with them until the baby is 4 years of age. These are some of the statistics that we found from 11,500 encounters. Our patient has 33% less C-section. They have 48% readmissions. They are 98% satisfaction is not just by the patient. We have 98% satisfaction of the physicians who are taking care of them, saying that moms that are under our programs were able to be more educated better, and so they knew what questions to ask when they came for the appointments. Our patients were adherent to breastfeeding 66% of the time for 6 months or a year exclusively, and they show 20% less depression. Our strategy is to work with every insurance company, self-insurance, employer groups, and others to create an ecosystem around maternal child health that will change the paradigm of what's happening in this country. So we are better next year in our in our outcomes. I'm sorry, I have to speak Welsh. I was told to speak, but if you have any more questions, do let me know. This is BabyLive Advice. Thank you so much.
Thank you so much. We have time for a couple of questions.
So commendable, by the way. Yes, absolutely. I have a lot of children, a lot of mothers, and something like this would have helped for a number of them. But the thing is how are you guys advertising this? How do you plan on pushing that to the mass market or to the public so that they're aware of this, or is it a closed system?
It is not a closed system, it's an open system. We have direct-to-consumer offering. We talk to a lot of mom groups, Moms 2020 and other very large organizations to have their moms access our site. We do provide membership. I'm sorry. Our membership is $49 a month for unlimited use of the platform. We literally made it so accessible that there is no mom left behind, if you may. We work in, and I can't speak too much about it, to very large health organizations across the country. And we are working with the hospital systems. So they are they are the one who will refer the moms to us. So when instead of sending a mom with a pamphlet that she cannot read when she leaves the hospital with a baby, they're actually gonna get the app and get a live nurse to talk to them and educate them.
That's great, that's great. And one thing to keep in mind is there's like an app called Ovia, which goes over the, when a female's fertile and so they're trying to have babies and everything, and it's taken off significantly. There's been no advertisement for that because it wasn't pushed on them by a healthcare provider. It's actually kind of a healthcare app. And if you approach it that way, maybe you'll increase the numbers instead of having the hospital system push it or just the medical providers. But very commendable, very, very brilliant, and congratulations on your release.
Thank you. I do want to say that 20% of our patients are actually fathers and grandparents and men. We don't just take care of moms, guys. We have everybody who takes care of a baby is actually a client of BabyLive Advice. So if you ever need our help, we're here for you. Thank you.
Any other questions for?
Yeah, any more questions?
Okay. How about the last?
I haven't checked your website, but I just looked at it, and so 26 million, babies, young parents who lose their babies prematurely, and you said that it's preventable. Anything for those moms who have lost their babies, like maternal depression and all that?
Yeah, well, we do see a lot of maternal depression, both in the pre and the postpartum period. We do have social worker and mental health providers who are certified in maternal depression, who can support moms throughout the pregnancy and postpartum as well. One thing I want to say about baby is that we don't touch a mom once. The idea of BabyLive Advice is that we have a 5-year span by which we can interact with any one parent. We can get you from preconception all the way till early childhood, so you can be with us for the entire time, and we will take care of you from you're pregnant until you see that baby go into kindergarten. Okay, thank you so much.
Thank you.